My name is Dr. Florian Kretz. I'm the medical director of Augentagesklinik Rheine and Augentagesklinik Greven in northwest Germany. And I'm very happy to share my experiences in how to deal with the current corona COVID-19 situation here. When we heard about the corona pandemic and we realized that more and more people are going to be affected in Germany, we straight away took the first measures. We cancelled all elective appointments and decided to only continue with emergencies and with intravitreal injections for macular degeneration, diabetes or occlusions. That was already before the first recommendations were out in Germany for ambulant practices and ambulant surgical centers. During that time, we have continuously tried to develop new ways in basically increasing the treatments that we can offer to our patients. So our complete workflow has changed in the practice. In our main facility in Rheine, we're working on 2 levels. So we have both levels open. One is for emergencies. The second one is for the elective treatments and post-op controls. In the second floor, we also have the entry to our OR. So usually all our patients went into the practice part and were then separated for patients that were just regular outpatients for their controls and the other patients that went in the surgical center for the treatments. Now what we did is that all our patients in the second floor are basically signing in on a webcam. So we built up a direct connection between basically our office desks to a webcam that is already in the hallway where the patients can also read in their identity card. So like this, we know very quickly if those patients have a surgical appointment or come for a control. The surgical patients then now use the back entrance into the OR and get straight away guided into the surgical facility, while the other patients go in the regular outpatient department for their examinations. Usually what they say is if you keep a distance of 1.5 to 2 meters and you stay under a time of 15 minutes, the infection rate is pretty low. So we try to optimize all our patients, our outpatient visits, to have a maximum time of less than 15 minutes. So we actually bought one of those like egg clocks that you have to time your eggs. And my employees are carrying them with them while they are examining the patients and talking to them to stick to the time limit. And it's a very simple way to also explain the time limit to the patient. And patients where we know because of counseling, of examinations, the time is longer, we try to switch the employees and keep the time even under 10 minutes. For the surgical patients, it's a bit more difficult because they come, they sign in, they have to be brought in the OR, the surgery has to be performed. So with our intravitreal injections, we actually managed it now that we have a total turnaround time with the patients of 10 to 12 minutes, meaning the patient comes, signs in on the webcam, basically the door opens, he gets taken in. While he's standing, he's getting eye drops for disinfection, ointment for anesthesia. He's brought in the OR, he lies down, and we straight away perform the intravitreal injection, and the patient can go home. I know that's different in the United States because there it's an office-based procedure and they don't have to go in the OR, but in Germany it's still accounted as a surgery, so it has to be performed under an OR setting. For our cataracts, it's a little bit different. So I had a long discussion with our anesthesiologist and with the whole team, and we tried to make it that our turnaround time of the patient is 25 minutes. 25 minutes from signing in, being guided in the OR, from the anesthesiologist who is explaining the anesthesia. The patient lies down, he gets a needle in the arm, and then he's straight away pushed in the OR. We perform the surgery, and the patient goes out, and he can leave the facility after 25 minutes. The other thing that you usually have is the difficulty is that patients should not sit close by. We separated the chairs with 2 meters, but what we also try to do is that we reduce the amount of patients. So actually, the patients are not really meeting at all anymore, and then even we have those space between them, they're not even sitting beside them because we changed the whole workflow. And that were really like the first changes that we made, and now we try to implement teleophthalmology for our patients as well.